Well, very good afternoon to all of you, dear students. I will be now dealing with page number 66 from your NCERT supplementary textbook, that is Snapshots, and the name of the chapter is Birth. So hereby, dear students, I am sharing the screen with you all. Please kindly let me know whether the screen is visible or not. It will be displayed in front of you shortly. So it is processing right now. Yes, now I am about to open the text. Yes, is the text visible? Please let me know about
Yes, sir.
it. Okay, fine.
Yes,
Okay,
sir.
okay. Thank you everyone for your feedback. So I hope you all did the class, and you know that I did up to this in my previous class, leaving his face. Up to this I did. So today, in this class from page number 66 only I will be continuing, and I will be continuing from this line. Okay, this line I will be continuing from, that is, his thoughts were heavy, muddled. From here I will be dealing in today's class. So let's move on. I hope the text is visible to all of you. So I am just scrolling a bit. Yes, now see, his here refers to Andrew, because it seems that he was very disappointed, because it was a frustrating evening, because he quarreled with Christine also, we know. And most important thing is that in this paragraph you won't be getting to know anything regarding the crisis, emergency, delivery situation as such. You will get to know about Andrew's insight or his thoughts related with relationships, because basically the bottom line of this particular paragraph it deals with broken marriages and failed relationships. Okay, so this paragraph is important from that perspective. And another important thing is that we are getting much more emotionally connected with the main protagonist, that is Andrew. We are getting an insight into his psyche or psychology also at the same time. See, the episode he had witnessed at Cardiff station still obsessed him morbidly. Maybe he met with Christine at the Cardiff station or near about a place like that, and still he was thinking about that quarrel. He thought of Bramwell. Now we are not sure whether Bramwell was a doctor or a person from the hospital. We don't know. He can be an individual, but one thing for certain, he is an acquaintance of Andrew. Okay, so he thought of Bramwell, foolishly devoted to a woman who deceived him sordidly, of Edward Page, bound to the shrewish blood vein of Denny. Now Edward Page also is having an affair with a shrewish lady by the name of Bloodwen, who was engaged with Denny, and thus Edward Page was also living unhappily apart from his wife. So whoever it is, whether it is his senior physician or doctor under whom he is working as a junior doctor by the name of Edward Page, or whether it is related with Bramwell, they are all victims of either failed relationships or they are victims of broken marriages. His reason told him that all these marriages were dismal failures. Initially he thought that marriage is something, an idyllic state, right? But his thoughts were totally broken after he had quarreled with Christine. Though we can find out, and according to me, I do feel like that he is very much committed to Christine, but we don't know whether Christine is also committed to him or not, because here we don't find any dialogue of Christine as such in this particular extract. So let us move on. His reason told him that all these marriages were dismal failures. It was a conclusion which in his present state made him wince. He was very thoughtful about it, and at the same time he was frustrated also, because thinking about broken relationships, thinking about failed marriages, he was thinking at the back of his mind what will be the future or what is in store in the near future related with his relationship with Christine. He doesn't know about it, but he was very anxious about it. See, he wished to consider marriage as an idyllic state. Yes, he could not otherwise consider it with the image of Christine before him. Now this shows that he was very committed, and it's true that he loved Christine a lot, because whenever he was thinking wrong about their relationship, every time the image of Christine comes in front of his eyes. Okay, her eyes are shining towards him. It seems that Christine's eyes were very beautiful and expressive, it seems so. Admitted no other conclusion, but sometimes he was thinking, okay, those thoughts all came together in his mind. Sometimes he was thinking that, okay, might be the relationship will improve in the near future, and sometimes he was thinking that, who knows, he will be a victim just like Bramwell, just like his senior doctor by the name of Edward Page. Who knows? It was the conflict. In his mind, he was having a conflict. He was in a dilemma. Okay, he was in a huge doubt, we can say, between his level doubting mind and his overflowing heart, which left him resentful and confused. Now, on one hand, he was in love. He was still in love. Emotionally, he was charged, totally charged. On the other hand, he had those fear, okay, doubting fear related with his affair with Christine, that what will be the outcome of this relationship in the near future. So, all in all, sitting in the kitchen room and looking at the fire burning in the fireplace, and gazing at the fireplace, rather to say in other words, he was thinking that what will be my relationship with Christine, whether it will be a failed one, it will be broken later, or whether everything will be perfectly right. But he is not sure, he is in a dilemma. And see, he let his chin sink upon his chest, stretched out his legs, stared broodingly into the fire. People say don't brood, because if we brood and it gets us reminded with the past incidents, if we go on brooding about the past incidents, maybe we are casual about our present, then we are harming our future, isn't it? So people say us not to brood. Brood actually means not to think about past things. The meaning of brood is also ruminate, R-U-M-I-N-A-T-E. Now the root word is stare. Stare means to glare, okay, look fixedly. He was staring at the fire, and he was thinking about Christine and all this. His thoughts were all related with his girlfriend Christine, see. He remained like this so long, and his thoughts were so filled with Christine that he started when the old woman opposite suddenly addressed him. Now this is something important. He was deeply in thought related with Christine. He had no other thoughts going on in his mind, when all of a sudden he was being called, and he got startled or surprised a bit, okay, because he was deeply in thought. Or when all of a sudden the old woman, the septuagenarian, the 70-year-old mother of Joe Morgan's wife by the name of Susan Morgan, that is Susan Morgan's mother, actually called him. Okay, her meditation had pursued a different course. That means he was being called once again, then again he had to move upstairs. Maybe some emergency situation came up. Okay, now I am moving on to page number 67. I hope page number 66 is clear to all of you. Is there any doubt? Any questions, dear students, at the back of your mind? Shall I proceed to page number 67?
Yes, sir.
Okay, fine. Thank you. So let us move on then. See, Susan said not to give her the chloroform if it would harm the baby. Now she is very desperate, because she is about to give birth to a child after 20 years of marriage. Emotionally, she is well connected very much to the child. Not only she is connected, her husband Joe Morgan, who was anxiously moving from one end of to the other end outside in the street. Okay, he was also well connected emotionally Her mother was also well connected. Everyone was hell bent on to receive the child. Now, Susan Morgan, she was not eager to take any risk. And as you know, without anesthesia, without chloroform, it will increase the pain in case of delivery. It is not possible. It is actually not possible, to be very honest with you all. So anesthesia, chloroform is a must. Okay, but she is not eager to use it because she is hell-bent on this, that I won't be using all this. Now, being a doctor, you have to convince the patient related with intake of any medicine. Okay, or being a doctor, you have to convince the patient party also. It's a very tough thing. Very few doctors have the ability to do that. We presume that Andrew has this ability, and Andrew did have this ability. See, she added in a low tone, "We all are, I fancy." He collected himself with an effort. "It won't do any harm, the anesthetic," he said kindly. "They will be all right." They means the mother and the child, they will be all right. So Andrew assured Susan Morgan, though Susan Morgan was actually a bit unconscious by that time, he assured the 70-year-old woman, the mother of Susan Morgan, that nothing will happen. Neither the child will be affected nor her mother will be affected in any way negatively. They will be perfectly all right. Now after that, again he came down. Here the nurse's voice was heard calling from the top landing. Again he was being called. Now Andrew glanced at the clock, which now showed 3:30. So you can say it is almost midnight now. 3:30, 3:30. He rose and went up to the bedroom. He perceived that he might now begin his work. Now, considering the situation, he thought that now it's time that I should do the operation. Or if it is a normal delivery, I should guide the mother to push the child so that the delivery procedure can be done smoothly. Okay, now he thought it's time for the delivery. An hour passed by. That means from 3:30 it became 4:30. It's almost about to be morning, right? It was a long, harsh struggle. Finally, the delivery was being done. It was a painstaking one, tedious one, long, harsh struggle. Then, as the first streaks of dawn strayed past the broken edges of the blind, the child was born. But oh ho, the child was born lifeless. Now this is something, it's a cause of concern, something very serious. Andrew had to deal with this now, okay. Now see, it was a long, hard struggle. Finally the child was born, and the first streaks of sunshine or light of the morning can be seen from the window panes. The child was born, but unfortunately it was stillborn. In medical terminology, it is referred as lifeless. It is also referred as stillborn. Now what Andrew will do? Now the biggest challenge of his life came right now. He had no premonition about it earlier when he was sitting in the car and about to proceed to 12 Blind Terrace, where Joe Morgan's wife was about to give birth to a child. At that time, when previously, maybe 1 hour earlier, maybe before that, he had no premonition that this will happen or this will come out to be like this. Now, the real challenge of Andrew started. Now, what Andrew will do, and you all know it very well that being a doctor is the most toughest profession. We feel like, doctor, oh yes, but no. Being a doctor is the most toughest profession because you have to deal with patients, okay, and patients and with patients also. And another important thing is that you have to take decisions within a fraction of a second, okay, and that shows it is the most toughest and most demanding, stressful and challenging profession in the world, in the whole world. And we find Andrew will take some quick decisions, okay. Now you see, I hope up to this it is clear. So the crisis situation came in the form of the child. After the delivery was been done, The child was found to be lifeless. Now, what is to be done? See, as he gazed at the still form, a shiver of horror passed over Andrew, because Andrew never ever at the back of his mind expected it, that the child will be born like this, lifeless. But now something should be done. After all, remember, not only the medical knowledge will be used by Andrew, but Andrew will be incorporating, you will find later in the course of the story, some of his field work experience also, some of his practical knowledge also. We will find that Andrew will be using those things also in order to resuscitate the child. Resuscitate, this word you will find right now only. In medical terminology, dear students, the meaning of the term resuscitate is revive. Okay, so let us move on. After all he had promised, his face heated with his own exertions, chilled suddenly. He was sweating. At the same time, he was feeling a cool sensation also. When we are nervous, when we are scared, suppose you watch a ghost film, you are very scared after watching that horror movie. A chill down the spine will come. Similar here also we find Andrew was having a bit of a chilling sensation. We can see here he was sweating at the same time. He was a bit nervous, but being a doctor, you won't be allowed to be nervous. You can be nervous, but you should not propagate that nervousness. Then obviously the patient health will deteriorate more. He is nervous, but he is still very much active, very much eager to revive the mother as well as the child. So see now, he hesitated, torn between his desire to attempt to resuscitate. I already told you the meaning of resuscitate, revive the child, and his obligation. I hope you remember Ailing Planet. That one I will be revising next week. It is in your periodic test 3 syllabus. There we find a term like obligation. What I told at that time, it is related with moral duty and responsibilities. So obligation we can say responsibilities, ethical responsibilities, okay, towards the mother. So he had responsibility in saving the child. He had responsibility equally in saving the mother. Very difficult, the profession of a doctor, and see, he is in a dilemma. He had to take some quick action, and he will take it. Some quick decision he had to take. See, the dilemma was so urgent, he did not solve it consciously. Blindly, instinctively, he gave the child to the nurse and turned his attention to Susan Morgan, who now lay collapsed, almost pulseless, and not yet out of the ether upon her side. See, Susan Morgan, she is still unconscious. Why? Because the effect of the anesthesia, ether here means the effect of the anesthesia was also there, and it was a painstaking delivery incident. So she was very weak. She was medically, we can say, she was very weak, and no pulse can be found for a time being. So you can understand the situation. So what Andrew should do? Andrew first of all will save the mother, and then he will concentrate on the child. For the time being, he will hand the lifeless stillborn child to the midwife. Okay, see now, his haste means something when we are in a hurry, we call it haste. His haste was very much desperate. Frantic is also, the meaning is desperate. He is very much desperate. Something has to be done, and instantly, quickly, something needs to be done. Otherwise, he won't be able to save the life. He had to save the life of both of them, both the mother and the child. Look at his situation now. He had to take decisions instantly. See, here he had taken the decision instantly because the pulse can't be felt like. Okay, see now, it took him only an instant to smash a glass ampule and inject the medicine. So he injected a syringe on the body of Susan Morgan. Then he flung down the hypodermic syringe. Flung means immediately he had thrown it, and walked unsparingly. Unsparingly, the other meaning is frantically, or we can say desperately, to restore. The meaning of restore, I will give you a medical terminology here, revive. That is the meaning of restore. the flaccid omen. Flaccid means pale and weak. Okay. After a few minutes of feverish effort, feverish means desperate, her heart strengthened. Finally, she revived. Okay, so we can say ultimately the efforts of Andrew, the desperate, frantic efforts made by Andrew, all those efforts bore fruit because ultimately her heart strengthened. He saw he might safely leave her. Now he thought at the back of his mind, now I can leave her. She is now quite normal. Medically she is okay. Now she is weak, but she is okay. There is no risk related with her life factor right now. Now Andrew decided to work on the child. See, he swung round in his short sleeves, his hair sticking to his damp brow. He is sweating. He tug off his short sleeves, okay, because he was sweating, because it was one phase of a miraculous medical recovery that he did right now in reviving or resuscitating Susan Morgan. Now he will concentrate on the child. See now, where's the child? He gave it to the midwife, and look how backdated, superstitious the midwife is. She kept the child under the sodden old newspapers, thinking that it's a failed attempt it will be in order to revive the child, because she feel like the child is no more. But Andrew will save the child, and that actually consisted the remaining part of the miraculous recovery related with this stillborn or lifeless child. See now, the midwife made a frightened gesture. She had placed it beneath the bed, in the midst of sodden newspaper. See now, in a flash, Andrew knelt down. In a flash means quickly, because every second is important. Okay, every second is important now. Fishing among, what is the meaning of fishing, dear students? The meaning of fishing is searching, or another way you can say scrounging. Okay, that is also another meaning of fishing. Fishing amongst, it is actually in past participle. See why? Because see, st, t is there, it is in past participle. This line is, this particular word is fishing amongst the sodden. What is the meaning of sodden? Sodden means old newspapers kept in an archive, but here all those newspapers are kept in a pile under the bed, and the midwife, being so much orthodox and superstitious, kept the child in the midst of those old newspapers. So Andrew, without wasting any more time and thinking that Susan Morgan had revived a bit and will recover in due course of time, he decided to save the child. Okay, see now, he pulled out the child, a boy perfectly formed. The limp, warm body was white and soft as tallow. See, the meaning of tallow is given in the footnotes. The hard fat of animals melted and used to make soap candles, that is known as the tallow. The skin, okay, it is very hard, like the hard fat of animals. Now, the cord here biologically it refers, dear students, to the umbilical cord. Hastily, it is an adverb actually. Hastily means hurriedly. Slashed, lay like a broken stem, okay, on the bed, and it is on one part of the bed, we can say. The skin was of a lovely texture, smooth and delicate. The meaning of tender is delicate. The head lolled on the thin neck. The limbs seemed boneless, because the child, it seems that the child is weak and pale, and the formation of blood circulation is not there yet. The limbs are found, or it seemed to be boneless, but Andrew will revive the child. That will concerned with the second part of the miraculous recovery. One part was related with the mother of the child being saved. Now we have to look around how Andrew will save the child. Obviously he will be using his medical knowledge and experience as much as he received, and obviously the field work experience or the practical knowledge also will come to the forefront. That we will discuss in some other classes. Now I hope up to this it is very much clear to you all, dear students. Is there any doubt, any questions you want to ask me, or is it clear to all of you? It is clear? Have you all understood? Okay, fine. So I stop here. I won't hold you back. I know you have other classes also. Tomorrow I won't be continuing with this. Okay, let us hold it back a bit. Because in periodic test 3 we have poster making that I already did earlier. So being a weekend class tomorrow Saturday, I will be revising once again poster making with all of you. So with that I end the class. Stay safe everyone and have a nice day. Thank you everyone. Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you. Thank you everyone. Thank you.